Brought to you by GTA. We start with you.
As the investigation into whether or not a nurse caught COVID while she was a patient at the Guam Memorial Hospital continues, Hospital Administrator Lillian Posadas says the data shows GMH patients are safer than their stateside counterparts. Posadas saying the rate of COVID infection for patients and staff in U.S. hospitals is significantly higher than Guam's.
And it's not an uncommon incident.
Right.
So, let's not panic about it. Let's not go, oh my goodness, the hospital is not doing enough. Well, look at the data from the time that we started taking in COVID patients to now. One incident,
Right.
one person. So, let's not scare the community.
Yeah. Marnette Agabao, a GMH ICU and ER nurse, did not have COVID when she was admitted to the hospital, but she was listed as the island's 8th COVID fatality last week. Posadas said Agabao could have caught COVID from a visitor, and the incident is currently being investigated by the hospital's infection control team. Meanwhile, GMH staff have been hit hard by the coronavirus, with Posadas saying during the first wave, 12 hospital staff tested positive for COVID-19. Now, during the second surge, the number of infected hospital staff has almost tripled.
There's actually 32 employees. In this second wave, there are 32 employees, including some doctors who have now tested positive. So, that taxes our staffing situation because these individuals have to be out, they have to be isolated, and we have to give them time to heal and to recover.
So that means the hospital's infection control team has its hands full with full-on contact tracing underway.
The infection control team is making sure that if that staff exposed certain patients and even the co-workers within that area, they've been followed up and, fortunately, none of them have tested positive.
Posadas saying the 32 staff who have COVID are a mix of clinical and non-clinical staff. With the coronavirus sidelining nurses and doctors, she says federal help in the form of DoD critical care frontliners couldn't come at a better time.
If we can use all 15 in the emergency room and ICU, that will be tremendous because then at least we can open up more ICU beds.
Posadas adding of the 42 COVID patients at GMH, 6 are receiving ICU level care with 3 of those patients on ventilators. She also addressed calls to move non-COVID patients out of GMH and to GRMC, saying the private hospital can start by taking the public hospital's non-COVID telemetry patients. For Guam's News Network, Chris Barnett reports.
Brought to you by GTA. We start with you.